Okay, we'll go ahead and get started. And Betsy, if you want to keep admitting people, I will go ahead and start our session. So good day and a warm welcome to each and every one of you. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series, a platform dedicated to exploring the diverse landscape of advanced nursing care around the world. My name is April Kapu, Associate Dean for Strategic Partnerships and Global Affairs here at Vanderbilt, and I will be moderating today's session. Please let me take a moment now to thank Megan Allen, DNP Leadership student, and to all of our colleagues and coworkers who have worked so hard to develop and implement this program. The purpose of this series goes beyond borders. It is a journey to learn, to understand, and to foster connections that may lead to meaningful collaborations in the realms of advanced nursing practice, education, and regulatory frameworks. This series serves as an open invitation to communicate, share experiences, and collectively contribute to the enhancement of advanced nursing care on a global scale. As we embark on this journey together, we'll be using the familiar Zoom format for today's session. I kindly request that you keep your microphones on mute during the initial portion of the presentation to ensure a smooth experience for everyone. Rest assured, there will be opportunity to engage with questions and comments once the presentation concludes. And now, without further ado, let me introduce our esteemed presenter for today, an expert in the field of nursing who will guide us through valuable insights and perspectives. Dr. Jessica Van Meter is a flight nurse with Vanderbilt Life Flight. She serves as faculty in the Global Health Division of Emergency Medicine and is Associate Professor of Clinical Nursing at Vanderbilt University School of Nursing. She served as the first director of a bachelor's degree in emergency nursing program in Georgetown, Guyana, South America for 8 years, the first specialty nursing residency program of its kind in the Caribbean. The program is designed to bridge diploma-prepared nurses to a bachelor's degree focused on the care of emergently ill and critically injured patients. Upon successful completion of the program, the resident students' degrees are conferred by the University of Guyana. Of note, Dr. Jessica Van Meter was honored with the Global Impact in Nursing Award by the International Nurses Association at the United Nations in 2018. She also received the 2018 Vanderbilt School of Nursing Alumni Award for National Leadership and was Vanderbilt University Medical Center Magnet Nurse of the Year in 2018 and in 2019. Please join me in welcoming Dr. Van Meter.
Thank you so much, Dr. Kapu. I really appreciate you having me here today. I've been looking forward to today, but also looking forward to participating in this Global Health Collaborative for the rest of 2024. I can't thank you enough for your leadership and innovation in putting this together. And I think it's a great opportunity to bring students and faculty and alumni and our international colleagues that are far-reaching to discuss global health. So I have to tell you, when April graciously called earlier last year, it was a much warmer day than it is today. And we were discussing how she was putting this collaborative together. She asked me to speak about advanced practice nursing in Guyana. And, my feedback to her was, we're not quite there yet. Advanced practice nursing is more relevant now in Guyana than it ever has been. But it's not quite a thing just yet. But as we continued our discussions, we really talked about how the building blocks for solid bedside nursing practice, as it relates to the formation of specialty nursing education, are really the backbone toward the relevance for advanced practice nursing in a lot of glowing healthcare institutions around the world. And so that's really going to be my focus today, is kind of creating those building blocks to the point where advanced nursing practice is more relevant in the coming decade than it ever has been in the past. So I want to start with a bit of a global perspective. And we know as nurses and advanced practice nurses that geography, topography, language, traditions, culture, all of these things are really fundamental aspects of the social determinants of health, how people are able to get health care. And so with that in mind, Guyana is a South American country. It's the third smallest on the continent, and it shares its borders with Venezuela, Brazil, and Suriname. It's also the only English-speaking country in South America, part of the former British Empire. And though it's very much a South American country, it shares more common ancestral diaspora with its Caribbean nation counterparts, and really sees itself to be more a part of that Caribbean culture. And you really do kind of get that vibe in Guyana, sort of a Caribbean vibe. It's wonderful. And to the point where it's actually the seat of CARICOM, the Caribbean Community of Nations capital. The capital of Guyana is Georgetown, and the whole country itself has a population of about 735,000 people. So to put that in perspective, it's a bit smaller than the metro Nashville-Davidson County population in general. It became known as the Cooperative Republic of Guyana in 1966 when it declared its independence. And the nature of that name comes from an Amerindian word, Guyana, meaning the land of many waters. And you find that to be very true. The country is lush with rivers and waterfalls that are tributaries from the Amazon River and play a huge important part in industry and shipping and every day-to-day travel. So when I first began involved in Guyana, I was working on my DNP project. And it was really important to me to do that project abroad. And as part of the Global Health Division, really learned a bit more about Guyana. To note that the majority of the population density is really found along that coastline. About 80% of the population live on the coast. And to the west and south of that is really lush, dense rainforest. And so while there are communities there, they're really hampered by transportation, much of which is dependent on air or river travel. And what I found was that much in line with most low and middle income countries, the capital city and Georgetown Public Hospital Corporation, which is the hospital in which I worked, was really hampered with a number of things that we see throughout the world, an overwhelming number of patients, a lack of resources, the absence of specialty trained providers, and that included both the nurses and physicians. And all of these things led to an increased patient morbidity and mortality. And it's important to note that Georgetown Public Hospital Corporation, or GPHC, is the only level 1 trauma center in the country. It's the healthcare epicenter of 26 district hospitals throughout the country and outposts, and it's the largest government-run healthcare institution. The emergency department alone sees about 80,000 people a year, and we have 18 beds, a couple of benches, and some chairs. And so again, to put this in perspective, the adult emergency department at Vanderbilt sees about 80,000 patients a year as well, but we have a capacity of 92 beds. So in working in Guyana, especially wanting to advance nursing practice in general, it was really important to have some early conversations within our division to say, what is the scope of practice that we may be operating under? Because there isn't really an APP counterpart on the other side of the aisle. And then if we're working with nursing education, how supportive might the government, the Ministry of Health, and other leaders be to expand current nursing practice guidelines? And then it was really important to actively involve local leaders in any of the initiatives that we may have. And I can't underscore how important it is in today's global health challenges that collaboration and coordination stay at the forefront of everything. We had a wide variety of stakeholders and partners to advance the delivery of quality and equitable healthcare in Guyana. And this program serves as a collaboration between all of these entities. And what we really hoped may be like a certificate program or some sort of specialty nursing education really materialized into, as Dr. Kapu noted, a bachelor's degree in emergency nursing. This degree program really was built after looking at work previously done in the country. There was a lot of physician concentration programs, especially in the accident and emergency department, and it just highlighted the need for specialty nursing education, because specialty nursing education has a real transformational effect on patient care outcomes. It promotes higher quality improvement through advanced and evidence-based practice. It improves nursing engagement and impacts nursing retention. And so this degree program was meant to bridge diploma nurses, which is similar to what we would say our licensed practical nurses are, to a bachelor's degree in emergency nursing in 2 years. And our faculty would be nurses and nurse practitioners from Vanderbilt, but the degrees would be conferred by the University of Guyana. And I would be remiss if I didn't note the faces in this picture. I mean, these are the pioneers of nursing education in their country. And without the two ladies in the background of this photo, Sister Lewis and Sister Lackey Sharon, both of which have about 80 years of nursing education and practice between them. Their participation in the day-to-day aspects of this program really legitimized us when there were a lot of naysayers. Our curriculum, when we were writing it, was based on the Emergency Nurses Association core curriculum. And so we focused on the fundamentals of critical care, triage, prioritization, stabilization, and resuscitation. And this included both didactic classes and then supervised clinical experiences by Vanderbilt nurses and nurse practitioner faculty who were in country 14 days out of the month, really actively participating with our residents on the floor and in front of patients. And it was really important to us as there was some foundation for the American Heart Association's BLS and ACLS in the country, but it wasn't previously a part of nursing education. It wasn't a requirement for your job in the emergency department to have basic life support, and we wanted to change that. And so we incorporated it into our program. And so our training includes BLS, ACLS, and then PALS became introduced into the curriculum in 2020. We also really wanted to include collaboration of local experts as well as international experts when doing our weekly didactic sessions. So the second year curriculum really mirrors the first. However, they complete month-long rotations in peds, neonatology. They do some work with EMS and throughout the community hospitals. They do a ton of work in OBGYN, spend some time in the ICU. But my favorite part, and I think our faculty would echo the same, is that they complete a quality improvement project. And when I was speaking to Dr. Kapu, I was like, I can really go off into the weeds about these projects because they're so inspirational in the sense that it's the first time nurses were empowered to change their environment, to know that they could be impactful in the delivery of how they treat their patients, but also their patients' experiences. And then we really wanted our second year residents to embrace the idea of mentorship and to work with the first year residents as they work through residency life. So I wanted to take a moment just to highlight some of these initiatives because I really think that they're important. As I mentioned, it's really been the most empowering thing for our nurses. And this was one of the first projects that was completed, and one of our residents was really frustrated that they were learning to participate in a lot of these emergency procedures, but couldn't find anything that she needed to be an agent of change to participate in them with physician colleagues and other interdisciplinary specialists within the department. And so She took the time to create a chest tube kit and to, label all of the airway supplies and adjuncts. And this really seems very simple to us, but she was met with a lot of opposition. The way that we've done it in the past works. And she really changed a lot of people's minds when a number of critical care patients who were victims of a car accident came in, and lo and behold, all of the emergency procedure equipment was ready and labeled. And so by being an advocate for her specialty nursing practice, she really changed the mind of a lot of her colleagues. One of my great passions is involving my Vanderbilt School of Nursing students at the pre-specialty level in global health. And they're really innovative and have great backgrounds in research and advocacy and evidence-based practice and quality improvement, but they don't have that rich nursing background yet. And so they created a partnership with my Guyanese residents to really note how they could advance the quality of nursing education. And nursing discharge education was not a component of nursing practice at the time. And so nurses really took greater responsibility to be a part of patient education and kind of combat the increased bounce backs and primary care concerns we were seeing in the ED, and created these culturally applicable adult and pediatric pamphlets based on WHO data reflecting top causes of emergency department visits. And it was really integral, I think, to expanding the scope of practice in nursing. This was another important collaborative where we worked with my VUSN students and my Guyanese students, and was really timely because it started in 2018 before COVID. But in a place especially where we have an overwhelming number of patients, only one sink, and are often hampered by a lack of hand washing supplies and a lack of appropriately sized gloves, it was really important that hand washing be at the forefront of any of the work that we did. And so we partnered with Dr. Talbot at the medical center and Georgetown Public Hospital's QI department in order to improve hand washing and really change the department culture and improve compliance by 20%. This was another nursing-driven medication safety initiative in that we don't have an AccuDose. And so it's really important to deliver the right medication to the right patient at the right time. And these nurses worked with carpentry to create these custom-built shelves and organize medications by class in order to ensure that we improve safe medication administration and decrease time of delivery to our patients. Especially given the fact that we incorporated BLS and ACLS into our curriculum. Nurses were playing a direct role in resuscitation, and we didn't have resuscitation documentation in which to use. And so this was another awesome collaborative effort to use the resources that we had and create a resuscitation form. I was super proud of this one. This is an awesome project in which, especially in an emergency department where we see the lifespan, we had some dedicated nurses who really love the little people, and our precious pediatric patients were given a bright and happy spot in the emergency department. And then last but not least, I wanted to highlight this mindfulness work where our VUSN students really wanted to be impactful in how they approached nursing, and knew that they couldn't really work to change the stressors that our Guyanese nurses have as far as patient ratios. Oftentimes our nurses are dealing with ratios of 1 to 15 and 1 to 20. And so to really think about how we can look to manage our own stresses and take care of ourselves was really I think, monumental project that I loved participating in. So once the stressors of kind of the day-to-day hectic nature of creating a program like this started, and I was really able to not create the next week's curriculum the day before, we really started as a team and a division look at how we could move toward capacity strengthening that included not only our nurses in the emergency department, but maybe even nurses throughout the hospital, nurses throughout the region and the country, but maybe include other interdisciplinary professionals, and looked at sustainability in other programs that would uplift the quality of patient care in general. And one of the first ways that we did that was to implement a PALS program. The success of this was really built on the fact that it was interdisciplinary. It included physicians and nurses from the emergency department, internal medicine, EMS, pediatrics, and our only pediatric surgeons in the country. And thankfully, I have some wonderful colleagues at the Children's Hospital, and there was some really gracious leaders over there that let me take the entire VCH education and outreach team with me. And in that time, we trained 10 new instructors and 28 new PALS providers in a country that had previously had no PALS at all. In a similar vein, neonatal education, especially in a country that has been wrought with really abysmal maternal fetal death rates. The education and outreach team brought their 2 high-fidelity neonatal simulators. I think Mary Lee Limley may have simulated over 100 childbirths in about a week. We emphasized neonatal assessment, airway management, and CV support. And we're really able to include nurses throughout the entire hospital, as well as a lot of our physician colleagues as well. Another area that was really important, especially coming from the only level 1 trauma center in the entire country, was a partnership with Rad Aid. And Rad Aid International brings radiology equipment to low resource areas. And they not only do that, but they deliver education, equipment, infrastructure, and then support. And they donated our first CT scanners to the country. And so we were able to partner with them, our nursing colleagues and physician colleagues, to work on CT scan education and safety, patient transport, the use of X-rays, ultrasound, and then mammography as well. And this has just really fundamentally changed the way that especially we treat our trauma patients. So one of the most inspiring things to see is our nurse practitioners that are a part of our faculty. We're really teaching a lot of things at the bedside that would in the past not have involved nurses at all. And here you can see 2 of our APP colleagues working to teach other physician residents, but also some of our nurses about the use of ultrasound, which is really key in low resource settings, especially in places where we don't have bedside X-rays. And so this is just yet another one of those steps that I was speaking to Dr. Kapu about, where you see small parts of advanced practice nursing sort of creeping into the everyday conversation in Guyana. A huge component of sustainability is the development of a local faculty. And as a team, we really talked about sustainability from day one. It was important to teach, but it was also important to teach others how to teach. And so here are the first steps toward the creation of a local faculty were these wonderful individuals. And, one of my proudest moments just last year was handing over the reins to the first local program director, Brother Leroy Seeley. You'll see the brother and sister titles, and that really dates back to a time where the first nurses and physicians were part of the clergy, and now it's really seen as a sign of a title of advancement and administration. And so to see Brother Seeley leading this wonderful group of graduates is really, really impressive. There's always 2 classes that are concurrently enrolled, and we have an annual enrollment. And as I noted, the graduates are now instructors, which is really a key point to maintain sustainability. Our first class graduated in November of 2018. We have a 100% pass rate in BLS, ACLS, and PALS. and 60% of the emergency department staff are either current or recent residents. One of my greatest joys, additionally, is to see that at the premier medical conference, the Guyana National Scientific Conference, we now see nursing-driven quality improvement initiatives accepted to the conference presented by nurses. And this was something that would never have happened 10 years ago. And I think another big step is that 20% of our nurses have now moved on to master's degree programs. And I think it really lends to the fact that, those building blocks of specialty nursing education really move into avenues where advanced practice nursing is really relevant. And so we have 10 graduates in master's degree programs in healthcare management, public health, and nursing education. This program has really created a platform for advanced nursing skills, the development of professional nursing practice standards where there weren't any before, the implementation of nurse-driven evidence-based practice and QI initiatives, and has really served to expand the scope of practice for nurses in Guyana. These are the foundations for advanced practice nursing, and it's more relevant than ever. Where we were the only bachelor's degree program in specialty nursing education, there are now 3 more. The bachelor's degree in neonatal nursing and cardiovascular nursing both started in 2021, and a bachelor's in nursing anesthesia began in fall of last year. I'm always asked about barriers to implementation of a program like this, especially one that we started from scratch, to the point where I literally have an entire lecture about just this topic. But what I can say for the purposes of today is really that despite a lot of these barriers, it was really always important to focus on the nurses in our program, to expect the unexpected, and to really celebrate our victories. I can't imagine the bravery that these nurses took in really being pioneers for specialty nursing education. And these are nursing leaders in Guyana right now. The program has successfully graduated a diverse group of nurses from 9 out of the 10 regions in Guyana. In 2023, we graduated our 5th batch. We have 49 residents who've graduated, and then 9 currently enrolled in both batches 6 and 7. So one of the things that I'm really charged with, I think, especially moving into more of a mentorship role, is how do we continue conversations that focus on advanced practice nursing and nursing into the future. And unfortunately, we've really been hit with some pitfalls in the sense that there have been massive shortages of nurses nationwide. Now, this is not unfamiliar to any of you. We know this is something we struggle with in the United States. But GPHC operates at about a 55% deficit now as far as staffing. Now, to put this in perspective, much of the Caribbean typically focuses at a 40% staffing deficit, but 55% is pretty extreme. There are about 600 nurses below staff, fully staffed. And record number of nurses resigned in 2022 and 2023. Much of this is due to brain drain. They have been recruited to other areas of the Commonwealth in the UK and Canada, and even the United States, where nurses have greater opportunity for continuing an education, advancing their education, and better pay, frankly. So one of the struggles that the government is working on now is that there are only 6 nursing schools with the capacity to train about 250 nurses a year. And that's just not enough to fill the hole. And so one of the things the government is working on is recruiting Cuban nurses, and they aim to recruit 1,000 nurses a year for 4 years. Now, this is fraught with some issues, some of which is where nursing, specialty nursing is in Cuba now as compared to Guyana, but also a language barrier for sure. Now, the Ministry of Public Health has worked to increase nursing salaries. And the numbers here are deceptive because they're in Guyana dollars, but it's about the difference between $500 US and $800 US a month for nursing education. And one of my frustrations, and the frustration of our team in the division, is that there remains no compensation for specialty nursing training. So on one hand, the Ministry of Public Health has been hugely proactive in propping up these international partnerships to create specialty training. But on the other hand, they're not recognizing that training with appropriate compensation. And then furthermore, specialty training isn't recognized by the Guyana Nurses Union, of which it is mandatory nurses join and pay dues to, nor the Guyana Nurses Association. Now, there is some more focus on creating hybrid nursing education programs, which I think is going to be fantastic. And then there's a lot of talk about future development of MSN programs and PhD programs in the country, which has not been something that we've offered in the past. But as many of you know, as advanced practice nurses who've gone on to get your DNP and PhD, this is quite a long game. For nurses to be able to finish their education at a doctoral level abroad, come back and lay the groundwork for what will be advanced practice nursing, is something that's probably going to move into the next decade. But yet, on a positive note, you can't open the newspaper and not see the impact that specialty nursing education has. I mean, it's just ever present. Our department in accident emergency saw 20% more patients than we've ever seen. We saw 50,000 total, 38% increase in referrals. And yet, per our documentation, as rudimentary as it is, we still managed to decrease wait times. And Dr. Bucks, our head of department, is really commending a lot of our specialty nurses and doctors who play a pivotal role in identifying patients that really need emergency care and throughputting them into a system that can be really bombarded. So one of the things that I'm really passionate about moving forward is kind of riding that initial wave that those first wonderful graduates started. And a lot of that is just a wave of change. And so how can we work to partner with the Ministry of Public Health so that there is compensation for specialty training and specialty education? And what other avenues might there be for further investment into other areas of nursing and specialty nursing education? So maybe pediatrics or critical care. There's a lot of conversation about how do we recognize specialty education in Guyana? Do we work from the top down with the stakeholders at the Ministry of Public Health, and then once that specialty nursing education is recognized, move forward to inroads into the Nurses Association and the union? Or do we start from the ground up and see if the union and the Nurses Association will begin to recognize more and more and more of these specialty nursing bachelor's degree programs? And then there's a lot of regulation currently in which higher level nursing administration leaders have to have a bachelor's degree background in midwifery. And that's a tradition that was, over 50 years old. And so there's much reluctance of change from a lot of the old guard, which is very understandable. But we now have almost 100 graduates with specialty nursing education who really, I think, will make some of the brightest future leaders in the country. And so I'd just like to take a moment to circle back to really the topic of the day, which is, I think the future for advanced practice nursing in Guyana is incredibly bright. The fact that we're able to have conversations about where nursing is going and the evolution of specialty nursing practice in a way today that wasn't present 10 years ago is just really, really phenomenal. And I think that the right people are in place and the right future leaders in Guyana are in place to really see this move forward. And so I'm excited to continue to be an advocate for the advancement of nursing practice in Guyana. So that's all from me, Dr. Capu, unless anybody has any questions.
Yes, so thank you. Thank you so much. So interesting. I have a lot of questions myself. We are going to open the floor for questions and comments. I would ask that you use the raise hand feature in Zoom, and I'll call on you in order. And when you begin to ask your question, if you could state your name and where you're from before asking your question. Just of note, we will plan to end the Q&A portion just prior to the top of the hour. And then prior to the close of this session, please take a moment. We'll place a link in chat for you to complete a feedback evaluation form. Would love for you to submit your feedback so we can continue to improve the series. And so we'll now open the floor for questions. And I believe we had a hand raised. Maureen, did you have your hand up there?
I actually had just given the clap for that was
Oh.
amazing. But I would love to ask a question.
Go right ahead.
First, yeah, thank you. First and foremost, Jessica, that was an incredible presentation. You have put in so much time and energy. So that's amazing. My question for you is, do you anticipate there to be specialties of APRNs in Guyana, much like the nurses that you have now?
Absolutely. I think that especially the way that specialty nursing education is dividing into the specialties, faculties are as part of different international partnerships. I really see that that's the next step. Is that we've, especially at Vanderbilt, for example, really propped up emergency nursing and have been partners with the nursing anesthesia bachelor's degree program. And I think that's going to be the next step is, do we have some ENPs potentially in the future or some nurse anesthetists?
Other questions? I'll ask a question in the meantime. One of the things, Jessica, you did was bring together a lot of different professions. So we've talked a lot about nursing today and the different types of nurses and how that is evolving. But you also brought in other types of professions, like you mentioned Rad Aid, but several groups from Vanderbilt Medical Center went down to collaborate. Can you tell a little bit more about that?
Absolutely. Those were, I think, some of the most rewarding projects that I participated in as director, but I can tell you they were pretty painstaking. The PALS program was really born from a lot of unfortunate circumstances where I think we saw poor pediatric outcomes because we had nurses and physicians that just didn't have the background for how to take care of those patients. And there was really a call from our Guyanese colleagues to help facilitate that education. And so once that ball got rolling, was able to move toward who were the best experts by which to deliver this education. How are we going to put it together? How do we make it sustainable? And it was really inspiring to see even our physician colleagues in Guyana jump on board. We trained 2 pediatric cardiac surgeons, the only 2 in the country who didn't have PALS because they would had to leave the country to go get it. And it was really wonderful too to approach our colleagues at Vanderbilt Children's Hospital and say, we think you're the best people to teach this. What can we do to help make this happen? And they were really gracious to allow that entire team of 5 people to travel with me. But it took about a year to put that together. And it's been hugely successful ever since. I think mostly because it was so interdisciplinary.
And if anyone wants to ask a question and put it in chat, we can do that as well. In the meantime, I'll keep asking questions.
Fire away.
Oh, here we have one from Vanessa, please.
Hi there, Jessica. Thank you
Hi.
so much for your time. My name is Vanessa Singh. I'm actually Guyanese. My parents were born in Guyana, South America.
Yeah.
I'm a Vanderbilt grad, class of 2016, and I'm a neonatal nurse practitioner I work at the University of Minnesota and have been here 8 years. Have been in the field of nursing for almost 13. So I was just curious, you talk about the need for specialization in pediatric care, pediatric nursing, but I was wondering if you can talk about even just neonatal care, premature infants. I know that it's a very under-resourced country, so I'd imagine that mortality is often high, but I have no idea about the perspective there because my family that had practiced medicine in Guyana were family medicine. And I come from a family of rice farmers, so.
Sure. Lovely to meet you, and thank you so much for joining today. I think it's a great question because one of the fundamental things that is difficult is that pretty much Georgetown Public Hospital there in the capital is the only hospital that has the capacity to care for neonates. And the way that we see neonatology in the United States is very different than they see it in Guyana. The average age of viability, gestational viability there is about 32 weeks, between 30 and 32 weeks. So, vastly different than here, where a lot of our trauma alerts are based on a gestational age of about 20 to 24 weeks. We see really great success in our NICU at 24 weeks here in the United States, and that's just not the case in Guyana. A lot of the sickest patients, to be really honest with you, are postpartum patients. The ones that come from the hinterlands, they've traveled for days, either by boat or by plane, with minimal care, and we'll get them, and they have a hemoglobin of 2, and we're flown on a plane holding their baby. So there's been a lot of work and a lot of focus to really prop up maternal fetal medicine, and there's some wonderful physician nurse residency programs that are focused on maternity, but I think even physician-wise, neonatology isn't even a thing, that specialty as far as physicians go. So that was one of the reasons why the bachelor's in neonatal education was so important, was to really create some ownership there. And there have been a lot of money and a lot of resources put into developing the first NICU in Guyana in 2016 at GPHC. So I think it's up and coming, and there are great strides, but obviously a lot of challenges as well, for sure.
Thank you so much for that perspective, that insight, and I appreciate your time.
Thank you. So we have a question in the chat. Why Guyana? What drew you to that country? And also, what lessons have you learned that can be applied in the United States?
Oh my gosh, good questions. So as I mentioned, I did my DNP project at the School of Nursing. And I really wanted the focus of that project to be in global health. And I really wanted to work abroad and have a wonderful physician colleague, Dr. John Paul Rohde, who works in our adult emergency department. And his parents were missionaries. He grew up in Guyana and lived there from the ages of 8 to 18. And he came back to the United States and wanted to give back after finishing his residency at Vanderbilt. He joined the faculty and just began taking colleagues down to just do like sort of rudimentary education programs. And it was really his initiative to help prop up a physician residency program in emergency medicine. And so it was just working with him and recognizing the fact that there were huge monumental advances in physician education. An EMS program had been started in 2015, but we'd really left out kind of a key component of that triangle, and it was nurses. And so I think he saw me as a great opportunity to be a part of sort of the nursing side of things. And so that's how I ended up in Guyana. As far as lessons learned, honestly, there's just so many. I think the biggest thing that I could say is that I've learned in working with this program to focus more on the people who were supportive of our initiative. It's really easy, I think, to get distracted by our naysayers. They tend to be the people who speak the loudest. And I really found like that I was putting a lot of time and energy into the people that didn't believe in us over the people that really did. And that was a mind shift for me. And I just started working to, really focus on the people that were championing our initiative. And it makes all the difference. It makes difference for your mental health. It makes a lot of difference for how you see the successes. And the fact of the matter is, when you are successful because you believe in nursing education, the naysayers, they come along over time. And so that was probably one of the biggest lessons. And I would say the second is relationships with people matter. Global health is all about partnership, and it's all about collaboration and coming together to find out like where your needs meet in the middle. And things take exceedingly longer than you would ever imagine. And while they're taking forever, all of those partnerships get stronger and stronger and stronger. And I think the fact that I was there 180 days out of the year for the better part of 8 years, they saw my face every day. They knew that I cared. And could approach me with any question or concern. Just showing up, I think, is kind of the answer to that, the end of that question. If you show up, a lot gets done.
Wow, thank you. So we have another question. In the meantime, I'll bring up the post-session evaluation for everyone to please fill that out. We would greatly appreciate your feedback. Our question is, in the United States, we have several certification methods. How is competency determined?
That is such a good question. So it's loaded in a couple of different ways. I can tell you how we performed competency within our program, which was through manners in which students were seen to perform hands-on, speak didactically. Obviously, we had written tests and verbal cues by which students walked through different patient care scenarios, final exams that were certified by the University of Guyana and an outside source. But really, other than that, outside of the residency programs, there is not any sort of background for competency at all. Just as there was not a core component to have BLS or ACLS or PALS be a part of nursing practice. And there's no background for CEUs or continuing education. And I think that's something that we're working to change. And I know the team at the emergency division of global health and I have really talked about is approaching the union to include continuing education as part of their annual recertification. And I know that that is coming. But as far as global nursing practice, there is no such thing for a garden variety nurse to prove any sort of competency at all. Ever more the reason why I think these specialty nursing programs are so important.
Thank you. Do we have any other questions? I'm sure I can see everyone. Okay, we have Susanna. We can't hear you.
I think I was having a headphone.
Oh, there we go. We can hear you now.
Susanna.
Hi, I'm Susanna. I'm a nurse practitioner. I'm currently practicing in upstate New York, but I graduated from VUSN in 2018. And then I was actually privileged enough to spend some time in Guyana with Dr. Van Meter back in 2018 as well. And it was a really meaningful experience, and I'm so excited to hear how much has progressed in the interim. And so I was curious, I do try to kind of loosely follow news out of Guyana, just having had the opportunity to travel there. And I have seen in recent months some headlines about potential conflicts in the area of Guyana that borders Venezuela. And I was curious if there are any potential changes to practice at GPHC or Vanderbilt's work in Guyana anticipated as a result of that conflict.
Awesome question. I really tinkered with the idea of including that as part of political instability, but was kind of afraid to get off topic a bit. And just to dovetail slightly, Susanna is selling herself short. She was a Frisk Global Health Scholar while completing her MSN. And so we threw her into Guyana for a month. The faculty and the students fell in love with her, and she was really instrumental in a lot of our discharge teaching, quality improvement initiatives. So they still talk about you, little Susanna. But yeah, so one of the challenges to a program like this, especially with an overseas faculty, is political instability. And there's some conflict currently where the socialist government of Venezuela has determined that all lands west of the Essequibo River that divides the country in half should be reappropriated by Venezuela. Now, interestingly enough, this area is mostly rainforest, Amerindian communities, and now rich with oil deposit. And so they held a referendum in Venezuela by which to seize half of Guyana's lands. We immediately had to make some moves to extract our Vanderbilt colleagues that were there. Unfortunately, Susanna, just because we didn't know what could happen, and the risk was just so frustrating. The current climate seems to be, hopefully, that it's just a lot of bluster. The international community, King Charles, as part of the head of the Commonwealth of British Nations, and the United States government have all said that that's an inappropriate seizure of lands. And the Venezuelan government has clapped back with, they do not recognize those governing bodies. So unfortunately, we're sort of at a standstill. We have a team going down next week. I think the climate will be maybe better understood. But so far, it's been a lot of talk, but little action, but is sort of at the top of the list of things that we're concerned about.
Great question. Are there any other questions before we close? Well, Jessica, this has just been amazing. I've learned so much and almost feel like I tagged along with you a little bit. So thank you for all the pictures and taking us along your journey. Wow, what an amazing amount of work you have put towards it, and what a difference you have made. So thank you so much for sharing your journey and your experiences with us today. And for everyone that has joined, please take a moment to fill out the feedback evaluation. We would love to hear from you and continually improve this series. And definitely want you all to join us again. Our next session will be on February 21st, where we will learn about advanced practice in Singapore. We'll hear from our colleagues, Ruth Kleinpel, Bridget Wu, and Wintao Zhou, who will tell us a little bit more, crossing the globe.